We move to angiotensin 2, and what we are discussing here is we are discussing everything on angiotensin 2 as related to hypertension. We're not saying angiotensin 2 can cause hypertension. We're not saying like it's a cause of hypertension. We're just trying to say it plays a role. Do you understand? So actions of angiotensin 2, this is what we're trying to look at. And let me just tell you guys what I know about angiotensin 2. I know that angiotensin 2 is from angiotensin 1, and angiotensin 1 is converted to angiotensin 2 by the action of angiotensin converting enzyme. So this angiotensin 2, when it gets into the body, its primary role is to what? You see how big this blood vessel is, but if angiotensin 2 acts on it, the blood vessel becomes smaller. So it constricts the blood vessels. So you say vasoconstriction. So if the space that blood was passing through, let me get a red pen. If the space that blood was passing through was this big, and it's yellow, so if angiotensin 2 acts on it, the space will become this small. So it will make it like, let me say in a city, you had a two-lane traffic road, but later on a new governor came in and destroyed one road. So a busy city has to follow one lane. So there's more traffic, there's more pressure. So if this continues, it could lead to high blood pressure. Okay. So angiotensin 2 primarily raises blood pressure by causing the blood vessels to become smaller. That's constriction, and it stimulates aldosterone release. It increases sodium and water retention. So sodium and water that gets to the kidney and we're actually supposed to be put out will be reabsorbed. Is it reabsorbed? Even before getting to the kidney, they'll be retained in the body even. Do you understand? So key actions is first is vasoconstriction. That's one of the biggest selling points of it. So it's a potent vasoconstrictor. It will narrow the arterioles. It will increase the systemic vascular resistance, and it will actually ultimately raise the blood pressure. It also stimulates aldosterone release. So it stimulates the adrenal cortex to release aldosterone. This will actually promote sodium and water reabsorption in the kidney. So even before reaching the kidney, the sodium and water could be retained. Even when they reach the kidney, they will still be reabsorbed back. So things that were supposed to put out of the body, they are brought back into the body, added on the already volume, high volume that is in the body. So you have expanded volume, and it's getting so big. So the sympathetic nervous system activity enhances norepinephrine release and reduces its reuptake. So antidiuretic hormone release, it promotes water retention by stimulating antidiuretic hormone secretion from the posterior pituitary. Vascular remodeling, it encourages smooth muscle cell growth and fibrosis in blood vessels, leading to long-term structural changes that sustain hypertension. Renal effects is actually constrict efferent arterioles in the kidney. Okay, so this is what we have. So clinical implication is essential hypertension. So if the RAAS system, that's the renin and angiotensin aldosterone system, if it is too much, you have too much of angiotensin 2, and this contributes to hypertension. Also secondary hypertension where the renal artery is becoming stenosed. Okay, it can increase renin. Of course, is the renin angiotensin aldosterone. Do you understand? So once renin is high, angiotensin 2 will be high. So this forms also a basis to why we develop some drugs that hypertensive patients can use. So they develop some drugs that will stop this angiotensin 2 from acting. That's their mechanism of action. Okay, so have like the angiotensin converting enzyme inhibitors. Those ones, they'll stop the enzyme that converts angiotensin 1 into angiotensin 2. Now remember that angiotensin 1 is not active. Angiotensin 2 is the one that is active. So once you stop the angiotensin 1 from becoming angiotensin 2, you solve the issue of the hypertensive patient. They will also have the angiotensin receptor blockers. Okay, so this one, you already have angiotensin 2 in the body, but this angiotensin 2 has to bind to some receptors before it works. So if you stop it from binding to those receptors, you solve the issue. The first drugs we talk about, an example is what lisinopril. This one, the example is what losartan. Okay, we have candesartan, a lot of it. I think I have about 8 drugs in that class. Then we have direct renin blockers like the aliskiren. So those drugs are the cornerstone of treatment of hypertension. So if you know this, you know what to prescribe. So that's what we got for angiotensin 2.